Well, welcome again to today's webinar, and we're going to focus on Breast Cancer Awareness Month, and in this case, breast cancer beyond the pink ribbons. What kind of integrative alternative therapies are offered at the Oasis of Hope Hospital? And we're going to start off with Dr. Contreras giving a presentation on the treatments that are recommended and offered here at Oasis, followed by our famous Q&A, which everybody loves. So while Dr. Contreras is giving his presentation, you can start asking your questions. We tend to get to the first questions faster. You can do that either in the chat box or through the Q&A section of our website. Just before we begin, Oasis of Hope has been around for about 63 years now. We're 63. 63 years now, and it is an amazing place. We're a ministry. First and foremost, we're a Christian-based hospital, and the great thing about Oasis is that our patients are inpatient. They stay here during their treatment process. We have patients from all over the world, mainly from the US, from Canada, but we have emotional support here, we have spiritual support here, and we have a great atmosphere here at the hospital.
We have a healing environment.
That's a great way of putting it. And I want to give a quick shout out to our current patients that are here at Oasis of Hope right now at the Infusion Center. They are viewing this webinar. Hello. You get to ask questions also. So if you do have a question, let the patient coordinators know and they'll give it to us. And why don't we start off with Dr. Contreras' presentation. Thank you so much.
Well, it's a privilege to have you in our podcast, and an honor that you are spending the time to be with us. Cancer of the breast is a major problem in most developed countries. Probably number one in incidence, not number one in death rate. And it's probably the malignancy that is most studied, where funds are almost limitless in order to review what's the cause and what types of cancers. Number of therapies developed, new therapies that are developed are more for cancer of the breast than for any other cancer. And it's because it's a major problem, as I mentioned at the beginning. Cancer of the breast is really a family of malignancies. It's not just one. And there are several types, and there are several aggressivity levels in each one of those types of malignancies. And since COVID, there has been a spike in this in the development of malignancies of the breast. The age range has dropped. That is, younger women are developing cancer of the breast, and more aggressive cancers of the breast have been appearing since then. And here at the Oasis of Hope, we are evolving with the time and all of these new therapies and new types of cancers, so that our treatment is very effective. It's probably the tumor where we have our best results because we attack malignancies, not just cancer of the breast, but all of the malignancies from two major points of view: the metabolic impact that cancer has and the immune impact that that cancer has. So our treatments are based on those two things, but we are integrative. If we find that a patient has a mutation where some of the new targeted therapies can be used, we will definitely use it. And obviously, if a tumor is hormone dependent, we definitely use hormone blocking agents, of which there are many. Most of them are available in Mexico. There are some of the new ones that are still not available here of the targeted therapies. But to us, we are going to offer our patients whatever we feel that is best for them, both from the alternative and the conventional realm. I think the major difference in how we treat cancer patients here at the Oasis of Hope in comparison to others is our philosophical stand which is based on two pillars. The first one is what the father of medicine stated, and which is first, do no harm. And we interpret that we should only do to our patients whatever improves their quality of life. And so sometimes when you say do no harm, well, surgery is never an option because that is, being aggressive against the patient's body. But if a patient is suffering from a blockage of the colon, well, then definitely we need to resolve that issue surgically. And that is, we do that in order to improve the quality of life of a patient. So we are going to do any therapy only when it is definitely going to improve the quality of life of the patient. And second is what Jesus said, love your neighbor as you love yourself. We say love your patient as you love yourself. We will never give any therapy to a patient that we ourselves would not be willing to do. And so this is something that we take into account every time that we design a therapy for our patients, that it would be something that we would do to ourselves or to a loved one. And because we do that, I believe that probably our results here are much better than in about just any center that treats cancer of the breast in the world. And so, again, I thank you for your presence, and we'll open up the session now for questions.
Thank you. Dr. Cecena, anything you want to add on, or you want to move on to the?
Just an illustration. In professional sports, there's a GM, there's a general manager.
General manager.
So we're like good general managers. We're also always selecting the best element or the best player for the particular position, and that's why we build a team. We always attack cancer as a team. That is bunching up against the cancer, and we always say that we would want to treat breast cancer, or prefer to treat breast cancer every day of the week and twice on Sunday.
It's always since I started working here, breast cancer patients are the largest population of patients that we do get here at Oasis. Is it more of a? Do you think it's more of a just in terms of the diagnosis or the population of patients, or?
There is no question that cancer of the breast is very prevalent, but I believe that one of the reasons why our largest contingent of patients is breast cancer is because of word of mouth.
Word of mouth.
The good results, they convey those results to other persons with the same problem, and that's probably the main reason.
And I've seen also that there's a larger population of patients that are virgin to treatment that come to Oasis.
Yes. Again, and that's because of word of mouth. And many people are aware of a publication that we did, a prospective clinical trial where treated patients of the breast with stage 4. And so we had two groups of stage 4 breast cancer patients, one group that was previously treated with conventional therapy, and then another group of patients that came to us without any treatment, or virgin to treatment, as we say. And the 5-year survival rate of the patients that were previously treated was very impressive. 50% of our patients.
In stage 4.
Yes. Well,
Previously untreated, right?
Previously treated. Sorry, it's not 50%, but the 5-year survival rate was 45%, and it's 3 times more than with conventional therapy. But you also have to take into consideration that these were the patients that were sent home to die.
Yeah.
So that result is incredible. But on the patients that came virgin to treatment, our 5-year survival rate was 5 times higher than the patients that were previously treated. So we're very proud and happy about those results. And so this publication is known to many people, and that's why more and more patients are coming to us virgin to treatment.
Great, great, great. Okay, let's kick it off with the legendary Q&A. People love this. All right, so we're gonna start off with the first question that was asked, Marcy Mays. How do you feel about remaining or treating with BHRT as opposed to
Aromatase?
aromatase inhibitors in treating ER positive and PR lobular breast cancer?
So, one of the things that the pathologists are going to give us as far as information is concerned is how how a patient's tumor is either hormone dependent or not, and how strongly hormone dependent. And also the age we take into account. Not every patient that is hormone dependent receives the same type of hormone blocking agent because it will depend on the percentage, it will depend on the age. And so it's not either or. It will depend on a number of factors whether we will choose one or other hormone blocking agent.
Okay.
Going back to the previous point, women, especially young women, want to preserve their quality of life. So that they will seek therapies that preserve their quality of life. And say, for example, hormone blocking is a treatment in itself, but it is a lot of the time short-lived. So that's where complementing or helping the hormone blocking therapy is going to allow you to maintain a high quality of life status over a long period of time before you ever need to consider other forms of therapy.
Okay.
Yes.
I got a follow-up question from the same person, Marcy. It says mastectomy has been performed with clean margins and radiation is underway as there was lymph node involvement. Does that change your answer?
Well, that means that the surgery itself was probably not curative, depending on how many lymph nodes. But here, for instance, when there was a mastectomy, and even though there are lymph nodes involved, we do not necessarily prescribe radiation therapy because our protocol has been so effective that we are able to avoid the radiation therapy in our patients. Although the newer type of radiation is less damaging than before, for this type of patient, it's a very broad area that is irradiated, and it's not possible to protect the lungs 100%. But fortunately, as I mentioned, the amount of radiation received nowadays is much less and much less damaging than before, and so it's a conventional option that has given good results in patients where the tumor was completely removed. There were no margins, but there were lymph nodes involved.
The point blank question that the patient will ask us is, Doctor, will your treatment substitute radiation therapy?
Correct, and the answer is yes.
And that we've done it, and in certain circles that might be called reckless, but we've been successful because our therapy is strong enough to substitute radiation therapy.
Yes.
All right, let's move on. Let's move on. Thank you for that question. A question we get a lot, but it's worth asking. What do you guys think of mistletoe?
Mistletoe has a definite anti-tumor effect. And my father did a prospective clinical trial many, many years ago comparing laetrile to mistletoe. And laetrile was so much better that he continued just to use laetrile instead of mistletoe.
Wow.
But it doesn't mean that it's not useful.
Okay.
It's just that laetrile was a lot. Well, the results of that study were much better.
An important point to make, if you're thinking of making mistletoe the only element against cancer, an important point to make is that we never do that. We never do one-on-one therapy against cancer. We always bunch up on it. That's the best way to approach cancer.
Yes.
Perfect, perfect. Rosemary's asking, had stage 2 breast cancer, did TCHP chemo, and it's been 4 years, but it adversely affected my health. It adversely affects my health still. How can I detox and restore my mitochondrial health and energy, muscle strength? Had no idea how toxic and lasting this was.
Well, the good thing is that you're tumor free. And yes, there's a number of things that you could do. We have a protocol here at the Oasis of Hope that helps patients recuperate from the damages of chemotherapy. There are some damages that could probably last a long time. Unfortunately, there are some that are permanent, but generally, with our protocol, your quality of life can improve, and some of those toxic effects can be reduced or reversed. So if you're interested, you could come for a protocol that we have precisely for those patients. And in fact, we use that protocol to precondition our patients. There are some patients that are going to need chemotherapy, or they want to do chemotherapy, but they want to reduce the risk of the chemotherapy. And so this protocol that I'm mentioning also helps patients tolerate chemotherapy better and protect themselves from the damages of chemotherapy.
Yeah.
And so this is a protocol that you might be interested in receiving.
Yeah, it's called the metabolic therapy. If you call our admissions office or send us an email or go online and fill out one of our contact forms, just say that you're interested in the metabolic therapy, and our admissions coordinators will know what you're talking about, and just say that you heard Dr. Contreras on the webinar and mention it.
And this protocol will also reduce significantly the possibility of recurrence. So all of the therapy that you did was to reduce the possibility of recurrence. Our protocol will even help you more with that.
It's two birds with one stone.
Yes.
It's reversing or helping the persistent side effects and protecting you against the future recurrence.
Got it. Okay, moving on. Mary is asking, what would you do for someone like me? Went through the standard triple negative chemo, which did not work. Lumpectomy, 25 rounds of radiation. Now, 1 month later, I do holistic things like hyperbaric treatment, hydrogen inhalation, trying to keep my immune strong, and I hope I don't have any reassurance. Thank you.
Well, one of our protocols, especially for triple negative breast cancers, which are generally much more aggressive than the typical hormone-dependent tumors, I think that if there's no tumor activity whatsoever now, our protocol, in your case, not the metabolic one that we were talking, but our complete protocol, including our impact protocol, which entails a cell-based or dendritic cell-based immunotherapy, would be very beneficial for you, because the possibility of recurrence in triple negatives is extremely high. And so I would definitely recommend our protocol in your case.
We do a best of both worlds approach for triple negative. It's a tough customer. And our results, our ability to help our patients skyrocketed once we started doing the impact therapy, but we still do multiple other associates to the therapy. So your treatment needs to be up to the task of dealing with one of the toughest cancers. And naturopathic therapy by itself can be too mild a therapy for an aggressive cancer.
Yes.
All right. Well, Mary, likewise, like I said before, give us a call. We'll be happy to set you up with a free Zoom consultation with one of our admissions doctors, go through your case and recommend treatment. And the program that Dr. Contreras and Dr. Cecena were discussing is the IMPACT program. It's called the Immune Personalized Autologous Cell Therapy. That is based on dendritic cells. We do lymphokine activated cells, natural killer cell therapy, tumor infiltrating lymphocyte therapy. So there's about 7 different cell therapies that we offer depending on the cancer type, cancer stage, and the physical condition of the patient. So it's amazing. It's amazing. So
Yes.
you learn more about it on our.
Consider it, seriously, if it's possible for you to consider the therapy, because if you If you delay and then your situation worsens, then you are handicapping any therapeutic effort. As strong as our therapy is, we want to deal with a monkey, not with a gorilla.
Okay.
Yes,
It's a good way of
that's
putting it.
good.
There's a bunch of questions on the root cause of cancer and breast cancers. I'm gonna just go through, maybe kill a couple of questions with that question. What is a root cause of cancer, in this case, breast cancer, in your humble opinion? Matt's asking that question.
So nobody knows exactly what causes cancer, but we all know what factors can increase the risk of breast cancer. And the most accepted one is what is called estrogen dominance. We as humans all are exposed to tremendous amount of estrogen and estrogen-like substances nowadays in comparison to, let's say, 100 years ago.
Plastics.
Plastics are leach chemicals that are very similar to estrogen. All pesticides virtually are in chemically very close to estrogen. And estrogen is on the list of carcinogenic agents. Okay, even though it's natural and it's produced by women's ovaries. That's why God gave women periods of rest from estrogen, menstrual cycles, breastfeeding, birth, or pregnancies gives you breaks. So definitely that is one of the important contributing factors.
Point to, that you can.
Yes, that is well accepted. Many other factors are there. So diet, many of the chemicals that are in our processed foods will increase the risk of cancer. Lack of activity. So the more active physically a woman is, the lower the possibility of developing breast cancer. And the other one is stress. Stress is a major factor as a contributing factor to developing cancer, especially cancer of the breast. But there is not one cause. Nobody knows. If we knew, we would then be able to develop the treatment against cancer, and we would find the cure. But to date, we have no reason. I mean, there is no cause. Mutations are the reason, okay? But why those mutations happen, we don't know. Basically, it is because our immune system is not able to get rid of the mutated cells, and then they organize and they grow. God gave us a system to get rid of mutated cells, but sometimes it just overwhelms the system. Yes.
Yeah, we're treating the disease after it has been triggered. The trigger itself is what we should be focusing on. If we knew it, we would treat the trigger, the origin of the disease. But we're always treating the disease after
the fact. Yes.
Well, it's about there's a lot of factors, estrogen, but the immune system has a lot to do. A well-functioning immune system should.
Correct.
Should.
If our immune system is up to par, we cannot develop cancer.
All right. Moving on. Let me see. Maybe you already answered this question, but what is the best treatment for HER2 metastatic bone?
So
Margaret.
HER2 is a mutation, and there are a number of. That's fine. Thank you. There are a number of anti-HER2 targeted therapies that can be very effective in patients when they have this mutation. Here at the Oasis of Hope, we use that only when necessary, because in most cases we're able to have very good results without using anti-HER2 targeted therapies. But it's an advantage that women with the HER2 mutation have, that there are other possibilities of treatment available to them in comparison to women that do not have the HER2 mutation.
Anti-HER2 therapy is similar to chemo in the sense that it keeps you going to the doctor's office every 2 to 3 weeks. and that is a compromise to life quality. So if we do treatment, proper treatment without compromising the life quality, that means the patient will be able to will be spared from having to be on a 1 year, 2 year regimen, which has you going to the doctor's office every 2 or 3 weeks. As easy as it may be, it's still, it's still not being free of having to be doing that kind of therapy sometimes over years.
Yes, so HER2 inhibiting agents are much less aggressive and much less toxic than chemo, but they do have their side effects, and so here at the Oasis, whenever we can avoid them, we will. But HER2 positive tumors have at least, a wider range of possibilities of treatment than women that are negative.
Okay,
It's an exploitable weakness
Yes.
cancer has.
I like that.
It's
Exploitable
it's a
weakness.
crack in the armor, which may be well exploited. HER2 disease. HER2 therapy can be life-saving, because only a few years ago, HER2 positive disease was the very worst cancer to treat.
Yeah.
These were very aggressive cancers, and beyond chemo, there was nothing.
Yep.
And now there are about 3 or 4 different anti-HER2 elements, which can be very, very effective.
Yes.
Perfect. Let me see. Okay, when Jake's asking, when women are on natural hormone replacement therapy, does getting testosterone, progesterone, or DHEA sulfite to optimal levels help prevent the negative side effects of estradiol?
That's a good question. It's difficult to assess that, and it's something that's ongoing.
I would say not if you have cancer.
Not if you have
Yeah, definitely.
Mhm.
And to reduce the risk, that's also very questionable. So hormone replacement therapy, even naturally, can be a problem for women. And I just want to say something. We as the medical industry has converted a natural process into a disease. What do I mean by that? So menopause is a completely natural human process. And we said, well, why don't we stop menopause and give you hormone therapy to avoid the change of life?
And
Yeah.
the
bell?
Yeah.
The frying pan.
the frying pan on your head.
What we mean by that is that mood swings are a big part of this process. And one of the things that I say, how do you know if you're going through that? Well, if your husband asks you for breakfast and instead you get the frying pan in the head, that's a sign that the woman is going through menopause. In the old times, it's a process that was suffered by women a few months, sometimes a year, and then, things went back to normal. But now we prolong this issue for years, and that's one of the factors, a well-known factor that increases significantly the rate of breast cancer. Mhm. And that is why I am not a proponent of hormone replacement therapy,
Okay.
even if it's quote unquote natural.
All right. That's a good question. Madeline is asking, how aggressive is invasive ductal breast cancer?
Well, if it's hormone dependent, it's not is one of the breast cancers, or the part of the family that is not the most aggressive, and where the results are the best when it's hormone dependent. So it's not too aggressive. There are 3 levels of aggressivity that we generally consider. When the tumor is well differentiated, that's the least aggressive.
Grade 1.
Moderately differentiated is a little bit more aggressive, and then the poorly differentiated, that is very aggressive. So as I mentioned at the beginning, The same diagnosis, depending on the aggressivity of the cells, can be less or more aggressive. So there's several things that you have to take into consideration. The age of the women. So a ductal carcinoma of the breast in a menopausal woman or postmenopausal woman is generally less aggressive than in a menstruating woman. So it's a complicated issue. But generally, the results in ductal carcinomas have been quite good, even in with conventional therapy.
So you find out in their pathology report what the grade of the disease is, grade 1, 2, or 3, and that'll give you an idea of how quickly you have to react and maybe plan to come.
Yes, 1 being the least aggressive, 3 the most aggressive.
All right.
3 is very time sensitive.
Very time sensitive. All right. Mary is asking, I have breast cancer, but it is on the skin. Do you have therapy for that?
Yes. So the skin is just another organ, so it would be considered a stage 4. Even if it's in the same breast and it has invaded the skin, and yes,
So it started as a melanoma and it converted into
no.
breast.
This is breast cancer
Okay.
that has grown into the skin.
Okay.
Or has metastasized. So the same tumor can invade the skin or produce metastases, which are called cutaneous. What's the name of cutaneous?
Skin spread.
Skin spread of the disease into. It's usually regional. It's very rare to find skin metastases that are very far away from the breast. It's usually in the thorax.
Right. Joanna is asking, what are the newest therapies for breast cancer, and what about surgery in the case of breast cancer? I mean, how, if surgery is the first option, should surgery be the first option, or should it be a preconditioning or treatment prior to breast cancer?
It's a good question, and it all depends on the stage. Surgery for early stage breast cancer continues to be the standard, the gold standard. So if we have a patient with a stage 1 breast cancer, surgery should be the first option. Which surgery will depend on where the tumor is. Generally, with stage 1, a lumpectomy is enough. And with conventional therapy, you have to go through either chemotherapy before and after, or definitely radiation after. We do, as we said before, we can substitute the radiation with our therapy here, and so a lumpectomy would be enough. Now, there are other times when a surgery is beneficial to the patient. For instance, fungated tumors that are destroying the quality of life of the patient. Then, in those cases, removing that tumor is godsend to the patients.
Okay.
It improves the quality of life. And there are other cases where the tumor is so massive that reducing the tumor load so that we have less tumor to treat can also be very beneficial to the treatment. So in general, we want to avoid surgeries, but in early stages, it's a curative procedure. This means that with a high level of certainty, that patient will be cured. And then that's it, that the patient doesn't need any more treatment.
And this isn't because Dr. Contreras is a surgeon, but at Oasis, one of the distinguishing shining points at Oasis is that very large tumors, I mean, tumors that are all over the chest, will not be touched anywhere else. And some of the patients that have been treated here by Dr. Contreras through surgery, because what the standard way to proceed is to do chemo and radiation to shrink a cancer, and then maybe they'll operate you, and that takes 3 to 6 months, and you have to hope that it works. Whereas surgery does it all in a single stroke, and sometimes it can't be done, but many a times when it appeared nobody else would do it, Dr. Contreras would, and some results have been very shining
Yeah.
examples of success.
I like it. I like it. All right. Long question. Hello, my mom is diagnosed with recurrent metastatic breast cancer. I'm trying my best to look for treatment. She is flying to Los Angeles from the Middle East tomorrow. Doctors said to admit her to the ER. I was thinking of alternative therapy, not chemo route, since they stated it's a matter of time, months, maybe 2 months to 2 years with treatment. Is the fact that she underwent chemo the first time mean she's not a candidate for alternative therapy, or does she have T cells still to fight?
As we mentioned at the beginning, most of our patients come here after chemotherapy failed them. So your mother is definitely a candidate. We have to see how her liver is functioning, her kidneys. We have to evaluate her. But if she was able to travel such a long ways, very likely she's still in very good condition. And since she's coming to Los Angeles, why don't you bring her for an opinion, a second or third opinion with us, so that she can then make an informed decision as to which type of therapy she would like to have.
All right, yeah, but give us a call or give us a call, send us an email. This is anonymous, so I don't know who you are, but we're here for you. Okay.
And if you don't, we're driving
2 hours.
2 hours
From
south of Los Angeles.
That's a good point. If a patient can come from the Middle East,
Middle East.
from the
Yeah,
Middle East and across the pond, and they probably can get here, and she's probably in conditions that we can treat. Our treatment is no picnic. We need a patient who is able to maintain a good condition through the 3 months that this treatment requires to be evaluated for results. Unfortunately, some patients are not in a condition to go through that. So we will individualize each patient and evaluate them for whether they are candidates to do our therapy beneficially.
All right, well said. Where are you located, Joanna? We are located in the famous city of Tijuana, Mexico, about a 25-minute ride from the San Diego airport. So San Diego, Tijuana is like a big city divided in half. So all of our patients, most of our patients, not all of our patients, fly into San Diego. We pick them up at the airport. We bring them down, red carpet treatment, and we love you and we hug you here. We're Mexicans, so we're warm-blooded people. So we love to hug, we love to talk. So yeah, Tijuana, Mexico, Joanna.
We all left our guns at home.
We only use them on Tuesdays.
All right, getting a lot of questions, and we always get these questions. Ivermectin, fenbendazole, go for it. I think you know the answer.
Well, there's no question that there's proven to a point anti-tumor activity from some anti-parasitic drugs, especially fenbendazole and menbendazole. There's much less information on ivermectin, but more and more people are using it. There is sufficient scientific data that it could be helpful to cancer patients. And we have some patients that are taking it. First, when a patient comes to us, they have to comply with our very robust protocol that has a number of medications and nutraceuticals, as well as supplements. And if they can comply with all of those, and then on top of that, they want to take either ivermectin or fenbendazole or both, we are not opposed to it.
So it's not contraindicated to what we do.
Not at all.
You know, again, I would advise or warn the patient not to consider this type of therapy as a
standalone.
It's a standalone.
As a standalone.
as a standalone therapy, right? That you know.
I mean, it's a
that's
buzzword therapy. I
that's
mean,
very risky.
You hear it a lot. You hear it a lot. Yeah.
Yeah.
So, but we have studied it, and we're not opposed to it. It's just it's not chemo or from
Let me put it in another light. We are so confident in our results from our therapy that we keep ivermectin, fenbendazole, and mebendazole always keep it in
In
reserve.
reserve.
Sure. That's a good way of looking at it, doctor. Lacey's asking, is there a viable alternative to tamoxifen if the side effects are too much to deal with?
Well, there's a number of hormone blocking agents that you can try, but there is no natural alternative to a hormone blocking agent.
Okay.
Because the process is very unnatural. Since your tumors are feeding, when a woman has a hormone dependent tumor, the tumor is feeding on the hormones that the ovaries produce.
Like the bodybuilders.
Yeah,
Yeah, they take their
they take hormones too.
they'll go
And so
like
the
this.
tumors take advantage of that. And so when a tumor is strongly hormone dependent, we don't want any of those hormones, and that is not a natural process. So you have to. Now, one difference is that from the point of view of conventional medicine, you have to take hormone therapy forever.
Okay.
No, once we have good results and the tumor is completely controlled, well, we allow our patients to stop the hormone blocking agent. And if there's any sign of reactivation, well, we'll go back.
Holidays. People always
Yes.
enjoy the holidays.
The holidays.
And things are so well that we can have the patient take the luxury of taking a pause or holiday from their therapy.
Yes.
I love the color commentary. It's always a pleasure to have him on our webinars. I'm gonna invite you more often, Doctor. You can't say no next time. Okay. Valerie is asking, sorry, let me see. Okay. When breast cancer has metastasized to the liver and femur, what is the prognosis and protocol? We are on Ibrance and anastazole.
The prognosis can change dramatically because even what she's taking now can be very effective in reversing the metastasis to the bones and to the liver or to wherever it goes. And so the possibilities of response are very good. And if you combine it with a therapy like ours, the results are going to be even better. As I mentioned before, even after chemotherapy, our results are 3 times better than with conventional therapy alone when a patient already had chemotherapy.
I would say that the more frequent reason that we get patients who have done Ibrance is not because it failed. It's because it's a very difficult drug to tolerate.
Okay.
It'll compromise your life quality, if not your immune system. And that's why most patients don't do well on it and they're seeking something else. But hormone blocking, such as you are doing, is a treatment in itself, and you stand to do well.
Mm-hmm.
All right. Patricia is asking, what are you doing to address emotional stress, and what kind of diet do you recommend?
Okay, so in life, we respond to everything with emotions. And a patient that is under duress from cancer is having, challenges, emotional challenges, anger being one of them, resentment. Many of these emotions come into play. And the way for you to better manage your emotions, people talk about emotions being positive and negative. I see it differently. I think your emotional reaction can be functional or dysfunctional. And your emotions will be functional if you are strong, if you have a strong spirit. If you're spiritually strong, generally your emotions, no matter what it is going to be functional. What do I mean by that? Well, normally we would say that anger, right, is a negative emotion. But if you get angry because somebody is not eating and you do something about it, well, you did something functional with that emotion. And again, your emotions are going to be functional or dysfunctional based on how strong your spiritual life is. And so what do we do here? Well, the first thing is that we want you to have spiritual resources. We are unashamedly Christian, and we believe that if you have Jesus in your heart, you know that you have victory because you are going to spend eternity in heaven. And that is going to change your outlook on death, because we're not going to die. We're just going to graduate into a better place. And so that changes everything. So you're spiritually strong, and so your emotions are going to be more functional. And the more functional and the more positive you are on the outlook of your eternal life, well, then the possibilities of response are much better because you are in less stress. One of the strongholds of cancer is fear, right? And it's fear of dying, even though we all know that we're all going to die. Just the fact that somebody gave you a date changes everything. And so this fear is managed only by being spiritually strong. So what do we do with that? We are going to give you spiritual resources, but we also have a psychologist here on staff, full time, that will help patients deal with anxiety, with depression, with anger, with resentment, and looking at all of that. This is what actually means to have a holistic therapy, that you address the physical needs of the patient, the emotional needs of the patients, and the spiritual needs of the patients. And I am a strong believer that the reason for our success is precisely that we treat our patients wholly, body, mind, and spirit.
Well said.
Losing your health is like losing a loved one. Losing is like losing your mother. So you are grieving. You are grieving, and you may not have been, as Dr. Contreras said, we are not unashamedly Christian. We encourage our patients to turn to our God of tender mercies, and there's so much to be gained. It's one of the few positives when you lose your health, when you lose your when you get disease. One of the few positives is that might be a strong reason why you turn to search, seek, and know God profoundly, and ultimately that helps you with the fight, even. So,
Amen. Yes,
Amen.
it does.
Amen. Amen. Can you give us, Saud is asking, can you give us a brief summary of your treatment protocol? Well, I mean, it's immunotherapy and metabolic therapy. So I'll let you give a rundown of the list.
So one part of the therapy is addressing the common denominating factors of cancer. And by this, I mean, all cancers will have certain common denominating factors. For instance, all cancers require a high amount of sugar. And so diet is very important. So our diet is low glycemic, low protein. And all tumors dislike oxygen. So oxygen therapy, especially with ozone therapy, is very important, and so on and so forth. That's the metabolic part. And then the other, which is common to all patients. And then we have the very personalized therapy, immune therapy, our impact protocol, is where we obtain information from your tumor, and we provide that information to your immune system, so that you fight your own tumor with the best possible element to destroy it, which is your immune system. And so we have this two major therapies, one that is very common to everybody, and then the other one that is extremely personalized. And so, in a nutshell, that's what it is. When you visit our website, you will see then each one of the elements. It would take a long time, and then we wouldn't have time for more questions.
Yeah.
But it's very clearly and easily outlined in on our website. And also, if you get my latest book, The Art and Science of Undermining Cancer, we spend a lot of time explaining every step and every one of the therapies that are offered here for our patients. And it's an easy read. It's written in layman terms, so that you don't have to worry that it's going to be convoluted and complicated. So I urge you to get that information either from the book or from our website.
Thank you, thank you. Yeah, go on our website. Everything's personalized. All treatments are personalized at the end of the day. So even though we use common or multiple treatment modalities on same patients, everything gets more personalized as time goes on. So yes, go on our website and review our treatment options. Let's see, I have a long question here. I don't know if I'm pronouncing this correctly, Mosgan. I have stage 4 breast cancer, triple negative. What are your thoughts about Manjaro? I was on it for a year and a half on a high dose. The mass started growing on my left underarm. When I told the endocrinologist, he said nothing. And 3 or 4 months later, I felt something in my left breast. I'm sure of it. I'm sure it was caused by the shots. I never got a COVID vaccine. I know 2 more people in their 40s and they were on the same shots, meaning Manjaro. I was healthy my whole life. A client of mine that works in genetic testing said that those shots activates the gene if you were carrying the gene, and these shots activates and awakes the cancer gene.
I have to check on that. Dr. Cecena and I were talking about the possibility of using some of these therapies actually for our patients. And the information that we've acquired until now is that they do have anti-proliferative effect, is that they could be helpful for cancer patients. And also the fact that it addresses, most of these drugs address the insulin resistance, that it could be beneficial for a cancer patient. I would have to look into the fact of if it genetically may increase the risk of breast cancer or any other type of cancer. I mean, that information I have not seen in the search that we're doing, that's ongoing now, to determine for us if it could be beneficial for a cancer patient or not. So it's the first that I hear that it could, trigger mutations.
Mutation because of
GLP-1?
Yeah.
GLP-1.
GLP-1.
So many people are on Ozempic and all those new.
So we'll look into it. It's a good point, and so we're in fact researching it now, and with this information that you're giving us, I will look into that area as well. For the moment, my impression is that it shouldn't be a factor that helps tumor development. But again, I'm not an expert in this. We're just beginning with
our presumptive hypothesis is that if it's a substances that have such a strong effect on the body's metabolism, and that may be used against cancer in a integrative therapy approach, but we are very early in our research, and
we're always very careful. We will never recommend something to our patients that we are not completely convinced and that does not have absolute scientific backing for us to give it to our patients. But we'll look into this. I have not heard that it could trigger some mutations.
First time I heard, yeah.
Yeah.
Jake Ames, I think I emailed you a couple of weeks back. We have a discussion pending. He wants to work here at the hospital. So he lives in Ajic, Lake Chapala. So Dr. James, I'll email you tomorrow. Let me see. Cancer stem cells. What are the best way to get rid of them?
Well, there are several things. We use metformin because it's been proven, it's published, but there's a couple of natural elements promoted by I forgot the name of the French doctor that developed this, and now her daughter is doing it here in America.
Oh, Bolchansky.
Yes.
Bolchansky. It's Sylvie Bolchansky.
She has very compelling research done at a couple of universities here in America, And so we're looking into it. Again, we take our time in changing all of these things until we're completely convinced. And so if our group here makes a decision that we could substitute the metformin for these new, not new, but this natural elements, we will definitely consider them. But for the moment, we're still using the metformin.
It's just so effective.
It's
just so
effective
yeah.
and very cost effective.
Very cost effective, yeah. True. We have so many questions to get to, and the hour's almost up. We're gonna do like a fire round, like some quick,
Yes.
not maybe yes or no, but
It's called ping pong.
ping pong. Okay, let me see. I have a 2.5 centimeter size growth on my pancreas. Biopsy is scheduled. Surgery would be risky and difficult. Chemotherapy is only treatment offered. How would you treat this and why? And what
I would urge you to come here because pancreatic cancer is very aggressive and chemotherapy usually is not effective. And the tumor is already outside of the realm of curability. I don't know if you had a PET scan or not, but when a tumor is larger than 2 centimeters, the possibility of finding lymph nodes is too high and the surgery is massive. So instead of chemotherapy,
Tail of pancreas.
unless it's on the tail of the pancreas, then even if it's more than 2 centimeters, it should be removed.
Okay.
But I'm assuming that it's in the head of the pancreas. Most of them are. But Dr. Cecena is correct. If it's on the tail of the pancreas, then surgery is still a good option for you. But our treatment has proven to be more effective than chemo, and the tolerance is just so much better.
Send us the details to what.
Yeah,
Yeah.
so that I can tell you for sure surgery, yes or no.
Yeah, Richard, send us your details, call us, and we'll be happy to get a recommendation to you. Andy is Andy, have you ever treated patients with T-LGL leukemia?
Which type?
It says T-LGL leukemia.
Large.
T-LGL. Aquí está.
Yes. No. Well, we generally do not treat leukemias because leukemias are very aggressive tumors, and fortunately, chemotherapy in most cases is effective. So we will recommend chemotherapy. We will bring the patients after for recuperation.
Consolidation.
And consolidation, unless it's a chronic leukemia. Now, so chronic leukemias that are gives us time, and in those cases we may treat you. So I will find out what this
T-LGL leukemia would do and what the.
If it's an acute leukemia.
If it's acute leukemia, our treatment is not the treatment of option.
Okay.
The first option.
Jade is asking, I'm currently undergoing radiation for metastasis. I imagine it's breast cancer. How long should I wait before I come to the clinic?
No, you can come immediately after. You don't
Okay.
have to wait. I'm assuming that it's to the bones, and radiation therapy to bone metastasis is actually quite beneficial for the patient. It's generally a low dose.
What should she do for the pain?
Well, I hope that when she finishes, the radiation is going to be much better because it's very effective in controlling pain. And so depending on how much pain was resolved, then we can decide on which analgesic would be the best for you.
All right. It's a good question. Lacey's asking, should triple negative breast cancer survivor have a full hysterectomy offered instead of hormone blockers?
No, with triple negative,
No.
hormone blockers are not necessary.
Okay.
Maybe she's BRCA positive, and that's why.
Well, okay, if the patient is BRCA positive, then the risk of developing ovarian cancer is quite high. And so doctors will usually recommend for the ovaries to be removed, and usually they will remove the uterus.
Especially if there's a family history of either breast or ovarian cancer, it's likely that this is a genetically conditioned situation, and then surgical prevention is not a bad recommendation.
All right, right. You see, HER2 breast cancer chemoradiation many years ago. Currently taking fulvestrant injections and Versenio orally. I'm not wanting to continue treatment. Do you have a program that can be an alternative?
Yes. So
Okay.
Dr. Cecena mentioned it a while ago, not with
Yeah.
Versenio's, but with any of the other targeted therapies that sometimes are not well tolerated, our protocol would be a very good substitute.
Okay.
I would say that whatever you're not tolerating on that regimen is likely related to Versenio. So our practice is to get you off Versenio, substitute Versenio with our therapy. Fascidex is a very strong drug and will be a second front against your disease. And so depending on the aggressive nature of your disease, we might still allow for some hormone blocking to go on, and especially until you go into full remission.
All right. We're gonna do two more questions, okay? Two more questions. But thank you so much, guys, for joining.
I thought we've been doing all two
Two questions is.
It's
No.
fine.
all we've been doing is tumor questions. Yeah.
Always. Just so many questions. We wish we could get to all the questions.
You don't get two more.
Two more. All right. Let me see. Where
Those
was?
maths.
Yeah, I lost my place.
Sorry about that.
Do you recommend women never get breast implants?
That's a good question. I remember one time, at one time in the history, that we were recommending women never to dye their hair. And it was so stressful for them that we allowed them to dye their hair. So the new type of implants is they're not
Saline.
correct, saline. So it's a difficult. I would rather that women would never do something as aggressive, but it's just so emotionally important for some of them that it's a risk factor.
It's a risk factor. So it's kind of like not doing exercise or
Yes,
not eating
yes,
healthy.
but
It's a risk factor.
but it's
Okay.
Details.
But-
What's your risk for recurrence? If your risk for recurrence is high, don't mess with big surgery.
But that's-
Okay, but that's
for patients that have no-
that's a very good question.
Okay.
Why are you doing this after mastectomy?
It's just
Or is it just to look better? I would rather that women would never do it, but I don't. I mean, it's just so happens so often. To me, the biggest risk is the difficulty in diagnosis,
Okay.
more than the implant itself. But women are
Women are women.
women are women.
Women, yes. We don't want to get in trouble here.
Yes.
We don't want to get in
Yes.
trouble here.
It's a good question. I do not, I will never say that never and that you shouldn't do it, but if you can avoid it, it would be better.
Got it. Lisa from Canada, I was fortunate enough to have visited twice for myself and my brother. Is it safe to keep on taking the nutraceuticals and prescription until my next visit?
Yes.
Lisa?
Yes, Lisa.
What's your last name?
Asimovich.
Asino.
That's how.
There's some elements in your therapy that ultimately we will stop while everything else goes on. So give us a call at the follow-up.
All right. Dr. Cecena is a follow-up doctor and director, so he knows. And if
Give us a call
we'll
at the
get to talk to
follow-up.
him. Also, Leona, it is so rewarding to hear a physician speak to the spiritual needs of healing. Thank you, and God bless you. Pastor Ernesto is the best. Even the doctors prayed with us at Oasis of Hope. So yes, we are very, very blessed. And I want to thank all of you for joining us for our breast cancer webinar, Beyond Pink Ribbons. Everyone, I want to just remind you that we do offer free Zoom consultations with our admissions doctors. All you have to do is call us, email us, or go online and fill out one of our contact forms. We'll be happy to help you. All you need to do is either fill out one of our medical questionnaires or send us your most recent medical records so we know what to recommend. And the free consultation is with Dr. Gutierrez. He's our admissions doctor, great doctor. Not only will he recommend treatment, he will pray with you also. And I want to thank all of you for everything. Dr. Cecena, Dr. Contreras.
Thank you very
so
much.
again
Thank you.
to the patients watching in the infusion room. I'll see you later on or tomorrow, and God bless you. And we'll see you. Dr. Contreras' daughter is getting married
Yes.
in 2 weeks.
So
we're
we'll
off
we'll
to
be
the wedding.
away
Dr.
for a
Cecena is staying,
yes.
fortunately. Unfortunately for him. So our next webinar will be the first week of November, and will probably be on nutrition and or an element of our immunotherapy. Also, one last thing, how many books do you want to give away this?
Let's say 20.
20 people receive a free book signed by Dr. Contreras. You'll get an email pretty soon on that. And if you are chosen, we only ship in the continental United States because we get patients from Singapore and and that's very expensive. So
Somebody has to mind the store.
somebody has to mind the store. Yes. Dr. Cecena, we thank you again for joining us. I know you're busy. Dr. Contreras, it's always a pleasure to be with you in these webinars. Have an amazing day. Good morning, good night, good evening,
God bless.
good afternoon, wherever you are in the world, and God bless you. Thank you so much.